What if I told you that doctors once performed brain surgery on screaming, conscious patients just to see what would happen? That they transplanted monkey testicles into humans for profit? That they infected orphans with hepatitis, gave pregnant women radioactive cocktails, and castrated gay men in the name of science? You probably think I'm describing medieval torture chambers or Nazi concentration camps. And yeah, we'll get to those. But here's the uncomfortable truth. Most of what you're about to hear happened in respected Western hospitals, prestigious universities, and government facilities. These weren't rogue monsters working in basements. These were doctors, professors, Nobel Prize winners, and they documented everything in peer reviewed journals. So, before we begin, hit that subscribe button, smash that like, because YouTube's algorithm really doesn't want you knowing that the medical establishment spent centuries using human beings as lab rats, and I need your help making sure this actually reaches people. Now get comfortable, maybe grab some water, and prepare to learn about 101 medical experiments that your biology teacher somehow forgot to mention. Let's start with something that happened less than 50 years ago in an American prison, the Holmesburg Prison Experiments. It's 1951 in Philadelphia. Dr. Albert Kligman walks into Holmesburg Prison and sees hundreds of inmates. His first thought, documented in his own words, "All I saw before me were acres of skin." It was like a farmer seeing a fertile field for the first time. Acres of skin. That's how he described human beings. For the next 23 years, Kligman used Holmesburg prisoners as test subjects for pharmaceutical companies, chemical corporations, and the U.S. Army. Over 300 inmates at a time were enrolled in experiments. They were exposed to chemical agents, dioxin, the main ingredient in Agent Orange, radioactive isotopes, and experimental drugs. Johnson & Johnson paid him to test skin products. Dow Chemical paid him to test dioxin exposure. The Army paid him to test psychochemical warfare agents. Inmates were paid a few dollars to have their skin deliberately burned, blistered, and scarred. Some developed permanent injuries. Many suffered long-term health effects. The cream that became Retin A was developed partly through these experiments. You might have used it. It was tested on prisoners who couldn't say no. Kligman died in 2010, celebrated in dermatology circles. He made millions. The prisoners got chemical burns and a few bucks. The experiments weren't fully exposed until the 1990s. And speaking of experiments where consent was a joke, let's talk about what happened to psychiatric patients in the 1950s. CIA mind control in Montreal. Dr. Ewan Cameron ran the Allen Memorial Institute in Montreal. Patients came to him for help with anxiety, depression, postpartum issues, normal psychiatric problems. They left as broken shells of their beings. From 1957 to 1964, Cameron conducted MK Ultra experiments funded by the CIA. He called it psychic driving. The method was simple: destroy the existing personality completely, then rebuild it from scratch. He would put patients into drug-induced comas for weeks, sometimes months. While they were unconscious, he played recorded messages on a loop through speakers under their pillows. The same message hundreds of times a day for weeks. "You are a good wife and mother," over and over and over. When they woke up, he'd give them massive doses of LSD, then electroshock therapy. Not the modern, controlled version. We're talking shocks 20 to 40 times more powerful than standard treatment. Some patients lost years of memories. One woman forgot she had children. Another forgot she was married. Several lost the ability to care for themselves, becoming completely dependent on family members for basic tasks. The CIA funded this through front organizations. The Canadian government knew. Nobody stopped it until the 1960s. Victims weren't compensated until the 1990s after lawsuits. Many never recovered. Cameron died in 1967. He was president of multiple psychiatric associations. His experiments destroyed dozens of lives, and the medical community knew. And speaking of prestigious doctors doing unconscionable things, let me tell you about a surgeon who became very famous for his miracle cures. The monkey gland doctor. In the 1920s, Dr. Serge Voronov became internationally famous for a groundbreaking procedure. He transplanted monkey testicles into wealthy men who wanted to regain their youth and vitality. Yes, monkey testicles into humans. Voronov claimed the transplants would restore sexual vigor, increase lifespan, improve memory, and cure various ailments. Thousands of men, including some of the wealthiest people in the world, paid enormous sums for the procedure. He operated at his own private facility. He imported hundreds of monkeys from Africa. He performed over 500 transplants on humans and thousands more on animals. He published papers. He lectured at medical conferences. He was taken seriously by the medical establishment for over a decade. The transplants did absolutely nothing except occasionally cause infections and immune reactions. Monkey testicles cannot integrate into human bodies. This is obvious now. It should have been obvious then. But Voronov made millions. Newspapers called him a genius. Other doctors copied his technique. The fad lasted until the late 1930s, when it became undeniable that the procedures were useless. Voronov died in 1951, largely forgotten. But for 20 years, he was cutting open men and sewing monkey organs into them. And the medical community just let it happen. Speaking of transplanting things that shouldn't be transplanted, let's talk about what Soviet scientists tried in the 1920s. Soviet human-ape hybrids. In 1926, the Soviet government funded biologist Ilya Ivanov to create human-ape hybrids. Not metaphorically. Literally, they wanted to create a new species. Ivanov traveled to French Guiana in West Africa with a team and the explicit goal of inseminating female chimpanzees with human sperm. He performed the experiments in 1926. None of the chimps became pregnant, so he reversed the plan. He wanted to inseminate human women with chimpanzee sperm. He needed volunteers. The Soviet government actually recruited women willing to be inseminated with ape sperm to create hybrid offspring for science. At least 5 women initially volunteered. The experiments were prepared, but before they could begin, Ivanov was arrested during Stalin's purges and exiled to Kazakhstan. He died in 1932. The experiments never happened, but they were approved, funded, and prepared. Soviet scientists were fully ready to artificially inseminate women with chimpanzee sperm to see what would happen. This wasn't rejected on ethical grounds. It was stopped because Ivanov fell out of political favor. That's the only reason. And speaking of experiments that only stopped for logistical reasons, let's talk about Nazi human experimentation, starting with the one that's somehow the least horrifying. Nazi hypothermia experiments. At Dachau concentration camp, Dr. Sigmund Rascher conducted hypothermia experiments on prisoners for the Luftwaffe. German pilots were dying from exposure after ejecting over the North Sea. The military wanted data on how long humans could survive in freezing water and how to revive them. So Rascher took prisoners and submerged them in ice water tanks. He monitored how long it took them to die, temperature, consciousness levels, time to death, all meticulously documented. Some experiments tested rewarming methods. Rasher would freeze prisoners until they were nearly dead, then try different revival techniques. He tried hot baths, internal irrigation with hot water, even putting frozen prisoners in bed with naked women to see if body heat would revive them. Around 100 prisoners died in these experiments. The data was presented at medical conferences. After the war, the question became, is this data usable? It was obtained through murder, but it's real scientific data about hypothermia that could save lives. The medical community largely decided the data was tainted and unreliable because Rasher was a sadist who may have manipulated results. But some of the findings have been referenced in hypothermia research. The ethical debate continues. Rasher was executed by the Nazis in 1945, not for the experiments, but for political reasons. His wife had faked pregnancies, and when discovered, both were killed. But Rasher's experiments were almost humane compared to what Dr. Josef Mengele was doing at Auschwitz. Mengele's twin experiments, Dr. Josef Mengele, the angel of death, had an obsession with twins. When trains arrived at Auschwitz, he personally selected twins from the masses being sent to the gas chambers. He saved them for his experiments. He performed experiments on over 1,500 sets of twins. Fewer than 200 individuals survived. He would infect one twin with diseases to see if the other would get sick. He performed surgeries without anesthesia. He injected chemicals into children's eyes, trying to change their eye color. He would kill both twins simultaneously and perform comparative autopsies to see how their organs differed. He sewed twins together, attempting to create conjoined twins artificially. He castrated boys without anesthesia. He performed vivisections on conscious children. One survivor described Mengele as polite and friendly when he visited the children, bringing them candy, then taking them away for experiments from which they'd return screaming or not return at all. Mengele escaped to South America after the war. He lived freely in Brazil until he drowned in 1979. He was never captured. He never faced trial. He died swimming at a beach at age 67. His research notes disappeared. What happened to most of his experimental subjects is documented only through survivor testimony. And speaking of Nazi doctors who escaped justice, let's talk about the ones who got jobs instead of prison sentences. Unit 731 escapes prosecution. While Nazi doctors faced the Nuremberg trials, Japanese doctors who committed comparable atrocities faced nothing. Unit 731, the Japanese Biological Warfare Unit, conducted experiments on an estimated 10,000 people, mostly Chinese civilians and prisoners of war. They performed vivisections on living prisoners without anesthesia to study disease progression. They infected prisoners with plague, cholera, anthrax, and other diseases. They tested flamethrowers on live subjects. They conducted pressure chamber experiments until subjects' eyes popped from their sockets. They performed forced pregnancy experiments, infected pregnant women with diseases, then dissected them and their fetuses. They tested grenades on living prisoners at various distances to measure blast effects. They buried prisoners alive to study asphyxiation. After Japan surrendered, General Douglas MacArthur granted immunity to Unit 731 members in exchange for their experimental data. The United States wanted the bioweapons research, so the researchers went free. Shiro Ishii, who ran Unit 731, never spent a day in prison. He lived comfortably in Japan until his death in 1959. Many of his colleagues went on to prominent positions in Japanese pharmaceutical companies, universities, and medical institutions. The experiments were hidden from war crimes tribunals. The data was classified by the U.S. military. Victims received no justice, no acknowledgement, no compensation. And speaking of using war as an opportunity for medical experiments, let's talk about what Allied doctors did to their own soldiers. Mustard gas testing on Allied troops. We covered racial segregation in mustard gas testing earlier, but the scale deserves emphasis. From 1942 to 1945, the U.S. military conducted chemical warfare experiments on approximately 60,000 American soldiers at the Naval Research Laboratory, Edgewood Arsenal, and other facilities. Soldiers were exposed to mustard gas, lewisite, and other chemical agents. Some were locked in gas chambers. Others had chemicals applied directly to their skin. The military wanted to test protective equipment and measure how different chemical agents affected human subjects. They exposed soldiers, watched them develop blisters and burns, documented the progression, then sent them back to duty. Soldiers were sworn to secrecy. Their medical records were classified. When they developed cancers and respiratory diseases decades later, they couldn't prove their illnesses were service-connected because the experiments were still secret. The program wasn't publicly acknowledged until 1991. Many test subjects had already died. Surviving veterans fought for benefits and compensation. Some are still fighting today. These were American soldiers, deliberately exposed to chemical weapons by their own military, then denied medical care for the resulting illnesses for 50 years. And speaking of militaries testing weapons on their own people, let's go back further to World War I. Plastic surgery experiments. World War I produced unprecedented facial injuries. Exploding shells and trench warfare destroyed soldiers' faces in ways medicine had never encountered. Surgeons had to invent techniques to reconstruct faces essentially from scratch. Dr. Harold Gillies in Britain pioneered modern plastic surgery by experimenting on wounded soldiers. This sounds noble until you understand the methods. Many procedures were experimental with no guarantee of success. Soldiers with horrific facial injuries became test subjects for untested techniques. Gillies would attempt reconstructions, see what worked, refine the approach on the next patient. Some soldiers underwent 30, 40, even 50 operations over several years. Each surgery was experimental. Many procedures failed, leaving patients more disfigured than before. Some soldiers spent years in hospitals as living experiments in facial reconstruction. To be clear, Gillies wasn't sadistic. He was trying to help, but the soldiers had no choice. Their faces were destroyed. They either accepted experimental surgery or lived with catastrophic disfigurement. Consent under those conditions is questionable at best. Gillies developed techniques that revolutionized plastic surgery. Modern reconstructive surgery exists because of his work, but it was built on the faces of soldiers who had no other options. And speaking of revolutionary medical advances built on questionable ethics, let's talk about the father of gynecology. J. Marion Sims and enslaved women. Dr. J. Marion Sims is called the father of modern gynecology. There's a reason his statues keep getting removed. In the 1840s, Sims developed techniques for repairing vesicovaginal fistulas, a devastating childbirth injury. He perfected these techniques by performing experimental surgeries on enslaved black women without anesthesia. Between 1845 and 1849, Sims operated on enslaved women he kept in a hospital building behind his property in Alabama. The women, including Anarcha, Betsy, and Lucy, endured multiple surgeries. Anarcha underwent 30 operations over 4 years. Sims claimed black women didn't feel pain the same way white women did, a racist pseudoscientific belief common at the time. He performed surgery on conscious women who were held down by other enslaved people forced to assist. He eventually succeeded in repairing fistulas. His techniques saved countless women from lifelong suffering. He became famous, operated on wealthy white women with anesthesia, and was celebrated internationally. But his breakthroughs came from operating on enslaved women who couldn't refuse, couldn't consent, and couldn't leave. They were property. He experimented on them until he got it right, then used the perfected techniques on paying patients. Sims died in 1883, celebrated as a medical pioneer. His statue stood in New York's Central Park until 2018, when it was finally moved after protests. And speaking of American doctors experimenting on the powerless, let's talk about what they did to prisoners in the early 1900s. Pellagra experiments on prisoners. In 1915, Dr. Joseph Goldberger was investigating pellagra, a disease causing thousands of deaths in the American South. He suspected it was caused by diet, not infection as commonly believed. To prove his theory, he needed to induce pellagra in healthy subjects. So he went to Rankin Prison Farm in Mississippi with an offer. Convicts could volunteer for his experiment in exchange for pardons. 11 prisoners agreed. For 6 months, Goldberger fed them a controlled diet designed to cause pellagra: cornmeal, sweet potatoes, rice, gravy, and almost no protein or fresh vegetables. The prisoners developed pellagra exactly as predicted: skin lesions, digestive problems, neurological symptoms. Goldberger had proven his dietary theory. He documented everything. Then he released them with their pardons. Some prisoners suffered long-term health effects from the induced disease, but Goldberger had his proof. Pellagra was caused by niacin deficiency, and thousands of lives were eventually saved by this knowledge. Here's the ethical question. The prisoners volunteered, but only because the alternative was staying in prison. Was that real consent? They knew they'd get sick. Some understood they might die. They chose temporary illness over continued imprisonment. Goldberger isn't remembered as a monster. He's remembered as the doctor who solved pellagra. The prisoner's suffering was a footnote in medical progress. And speaking of prisoners being offered freedom in exchange for their bodies, let's talk about malaria experiments. Stateville malaria experiments. We mentioned these briefly earlier, but they deserve full attention. From 1944 to 1974, Stateville Penitentiary in Illinois ran a malaria research program. Over 400 inmates were deliberately infected with malaria more than 1,000 times total. The University of Chicago and the Army ran the program. Inmates volunteered in exchange for reduced sentences or small payments. They were infected with malaria, then treated with experimental anti-malarial drugs to test effectiveness. The research contributed to developing anti-malarial medications used during W.I. Wood and beyond. Lives were saved by this data, but the prisoners contracted malaria. Some developed cerebral malaria, a potentially fatal complication. Some had recurring symptoms for years after release. All experienced high fevers, violent chills, and severe illness. The experiments continued for 3 decades. Hundreds of prisoners were infected with a potentially lethal disease for science, for credit, for freedom. Life magazine photographed the experiments in 1945, portraying the prisoners as patriotic volunteers helping the war effort. The reality was more complicated. They were prisoners who wanted out. Volunteering to get malaria was their best option. And speaking of experiments that tested disease transmission, let's talk about what doctors did to orphans. Willowbrook hepatitis studies from 1956 to 1970. Researchers at the Willowbrook State School in New York deliberately infected mentally disabled children with hepatitis. Willowbrook was an institution for children with intellectual disabilities. It was overcrowded, understaffed, and horrific. Dr. Saul Krugman ran experiments where children were fed live hepatitis virus in their food or injected with it. The goal was to study the disease's natural progression and test potential vaccines. Krugman argued that hepatitis was so rampant at Willowbrook that most children would get infected anyway. By deliberately infecting them under controlled conditions, he could study the disease and work toward a vaccine. His logic: they're getting sick anyway, so why not make it useful? Parents were told their children would receive good medical care. Some were told their children would be in a special unit with better conditions. What they weren't always clearly told was that their children would be deliberately infected with a liver disease. Around 700 children were deliberately infected over 14 years. The research contributed to developing hepatitis vaccines, but the children were used as test subjects because they were institutionalized, disabled, and vulnerable. Krugman faced criticism even at the time. By the 1960s, medical ethicists were questioning the experiments, but they continued until 1970. Krugman died in 1995, still defending his research. He never believed he'd done anything wrong. And speaking of institutions using vulnerable children as test subjects, let's talk about what happened at Fernald. Radioactive oatmeal at Fernald. We mentioned this earlier with MIT and Harvard, but the details are worse than the brief summary suggested. At the Walter E. Fernald State School in Massachusetts, mentally disabled boys were recruited for a science club. From 1946 to 1953, researchers fed these boys breakfast cereal and oatmeal, laced with radioactive iron and calcium. The boys, called the Science Club, were told they were special and helping science. They got extra food and treats and trips. What they actually got was radioactive isotopes in their food. The researchers wanted to study mineral absorption. Quaker Oats funded part of the research to understand how the body absorbed nutrients from their products. Parents received consent forms that mentioned dietary research, but never mentioned radiation. Most parents couldn't have understood the risks, even if told. Their children were institutionalized. They trusted doctors. The boys consumed radioactive materials for years. The long-term health effects weren't studied. The researchers published papers, advanced their careers, and moved on. The experiments weren't exposed until the 1990s, during a broader investigation into radiation experiments. Survivors and family members sued. MIT and Quaker Oats settled for $1.85 million. The boys were treated like lab rats because they were disabled, institutionalized, and powerless. The research was legal at the time. That's what makes it terrifying. And speaking of radiation experiments, let's talk about what doctors did to pregnant women again, but with more detail. Vanderbilt Radioactive Iron Study. In the 1940s, researchers at Vanderbilt University gave 829 pregnant women what they called vitamin supplements to improve their baby's health. The supplements contained radioactive iron. The women were told they were receiving vitamins. They weren't informed the vitamins were radioactive. The goal was to study how radioactive isotopes crossed the placenta and concentrated in fetal tissue. The researchers tracked these women and their children for years. Some children developed cancers. The cancer rates were higher than expected in the study population, but the connection to radiation exposure wasn't definitively proven. The women didn't learn they'd been given radioactive materials until the 1990s, when investigative journalists uncovered the experiments. By then, many were elderly or dead. Their children were middle-aged, some with health problems potentially linked to fetal radiation exposure. Vanderbilt apologized. The federal government paid settlements, but apologies don't prevent cancer. Settlements don't restore trust. These women went to doctors for prenatal care. They trusted medical professionals to protect their babies. Instead, they were enrolled in radiation experiments without their knowledge. And speaking of violating trust during pregnancy, let's talk about DES. Diethylstilbestrol. DES. Experiments from the 1940s through 1971. Doctors prescribed diethylstilbestrol, DES, a synthetic estrogen, to pregnant women to prevent miscarriages. Between 5 and 10 million women took it during pregnancy. Here's the problem. There was never solid evidence it worked. It was prescribed widely despite questionable clinical trials. Some trials were outright fraudulent, with researchers cherry-picking data to support DES effectiveness. The drug didn't prevent miscarriages, but it did cause cancer. Daughters born to women who took DES developed a rare vaginal cancer at higher rates. They also had reproductive tract abnormalities, fertility problems, and higher risk of breast cancer. Sons of DES mothers had higher rates of genital abnormalities and possibly testicular cancer. The effects appeared in the second generation, the grandchildren of women who took DES, showing potential epigenetic changes. Millions of women were prescribed an ineffective drug based on bad science. Their children and grandchildren suffered consequences. The FDA finally banned DES for use during pregnancy in 1971, but the damage was multi-generational. Doctors prescribed it confidently. Pharmaceutical companies marketed it aggressively. Nobody properly tested whether it worked or was safe. The experiment was conducted on millions of pregnant women and their offspring. And speaking of drugs prescribed before proper testing, let's talk about thalidomide. Thalidomide tragedy. In the late 1950s, thalidomide was marketed as a safe sedative and morning sickness treatment for pregnant women. It was prescribed widely in Europe, Canada, and other countries. Doctors called it the safest sleeping pill ever made, except it caused catastrophic birth defects. Babies were born with phocomelia, limbs that were severely shortened or absent, arms and legs replaced by small flipper-like appendages. Over 10,000 children worldwide were born with thalidomide-related birth defects. The drug was never approved in the United States, thanks to Dr. Frances Oldham Kelsey at the FDA, who refused approval because she felt the testing was inadequate. She saved thousands of American children, but clinical trials had distributed thalidomide to American doctors who prescribed it to over 2,000 pregnant women before it was pulled. At least 17 American babies were born with thalidomide-related disabilities. The pharmaceutical company, Chemie Grunenthal, had conducted minimal testing on pregnant animals. They marketed it as safe based on incomplete data. When birth defects started appearing, they initially denied the connection. The thalidomide disaster led to major reforms in drug testing and approval processes. But thousands of children were born with severe disabilities because a drug was marketed before proper safety testing. Some thalidomide survivors are still alive today. Elderly people who've lived their entire lives with disabilities caused by a drug their mothers were told was safe. And speaking of assurances of safety that turned out to be lies, let's talk about lobotomies. The lobotomy epidemic. From the 1930s through the 1950s, doctors performed tens of thousands of lobotomies, surgical procedures that severed connections in the brain's prefrontal cortex. The procedure was supposed to treat mental illness, anxiety, and behavioral problems. Dr. Walter Freeman popularized the transorbital lobotomy also called the ice pick lobotomy. He literally used an ice pick-like instrument inserted through the eye socket and swept it back and forth to sever brain tissue. The procedure took about 10 minutes. Freeman performed it in his office, in mental institutions, sometimes in his van traveling around the country. He personally performed around 3,500 lobotomies. He once performed 25 in a single day. He had no formal surgical training. He would hammer the ice pick through the thin bone behind the eye socket into the brain, then move it side to side to destroy tissue. The results were horrific. Some patients became vegetables, others lost their personalities, becoming docile and emotionally flat. Some died from hemorrhages or infections. A few seemed improved, mostly because their uncontrollable behavior stopped. Rosemary Kennedy, President Kennedy's sister, was lobotomized at age 23 for mood swings and rebellious behavior. The procedure left her permanently incapacitated. She spent the rest of her life institutionalized, unable to speak intelligibly or care for herself. Despite the obvious harm, Antonio Egas Moniz won the Nobel Prize in 1949 for developing the lobotomy. The medical community celebrated it as a breakthrough. Thousands of people, mostly women, were lobotomized for conditions like anxiety, depression, or simply being difficult. The procedure fell out of favor in the 1950s with the development of psychiatric medications, but the damage was done. Tens of thousands of people had parts of their brains destroyed by doctors who thought they were curing mental illness. Freeman died in 1972. He never admitted the procedure was a mistake. And speaking of psychiatric treatments that destroyed brains, let's talk about insulin shock therapy. Insulin coma therapy. From the 1930s through the 1960s, psychiatrists treated schizophrenia and other mental illnesses with insulin shock therapy. The procedure involved injecting patients with massive doses of insulin to induce a coma. The theory was that shocking the brain into a coma might somehow reset it and cure mental illness. There was no scientific basis for this. It was just something doctors tried. Patients were injected with insulin until their blood sugar dropped so low they'd slip into a coma. They'd convulse. Sometimes they'd stop breathing. Medical staff would watch them, then revive them with glucose after 30 minutes to an hour. This was done repeatedly, sometimes daily, for weeks. Patients underwent 50, 60, even 100 insulin coma sessions. The treatment was dangerous. People died from the induced comas. Others suffered brain damage from prolonged hypoglycemia. There was never solid evidence it worked. Some patients seemed to improve, but this was likely due to the intensive care and attention they received during treatment, not the comas themselves. The procedure was standard psychiatric treatment for 3 decades. Thousands of mentally ill patients were repeatedly put into comas in the hope it might cure them. It didn't work. It just damaged brains and killed people. The practice ended in the 1960s when antipsychotic medications became available, and studies showed insulin coma therapy was ineffective and dangerous. And speaking of treatments based on the logic of let's shock the brain and see what happens, electroshock therapy deserves its own discussion. Early electroconvulsive therapy. Electroconvulsive therapy, ECT, is still used today in modified, safer forms, but early ECT was brutal and often non-consensual. Starting in the 1930s, psychiatrists induced seizures by sending electrical current through patients' brains. The theory was that seizures might treat mental illness. They didn't know why. They just tried it. Early ECT involved strapping patients down and sending powerful electrical shocks through their heads without anesthesia or muscle relaxants. Patients were fully conscious. The induced seizures were so violent that patients would break teeth, fracture bones, and dislocate joints. ECT was used on schizophrenics, depressed patients, anxious patients, gay people subjected to conversion therapy, difficult women, rebellious teenagers. If you were mentally ill or socially deviant, you might get electroshock. Many patients were forced to undergo ECT against their will. They were institutionalized, and doctors had total authority. Patients would be dragged to the ECT room screaming and shocked until they were compliant. Some patients lost memories, sometimes years of memories. Others suffered permanent cognitive impairment. Many were traumatized by the experience itself. Modern ECT is different, performed under anesthesia with muscle relaxants, with careful monitoring. It can be effective for severe depression, but for decades, it was used as punishment and control, administered to conscious patients who broke bones during the induced seizures. And speaking of using electricity to control people, let's talk about what was done to gay people. Conversion therapy experiments. For much of the 20th century, homosexuality was classified as a mental illness. This meant doctors tried to cure it. The methods were horrific. Aversion therapy was common. Gay men and lesbians were shown same-sex erotic images while being given electric shocks, emetics to induce vomiting, or drugs to cause nausea. The goal was to associate same-sex attraction with pain and sickness. Dr. Robert Galbraith Heath at Tulane University in the 1950s and 60s implanted electrodes in patients' brains and stimulated pleasure centers while showing them heterosexual pornography. He was trying to rewire their sexual orientation through brain stimulation. In South Africa during apartheid, military doctors performed sex reassignment surgeries on gay and lesbian soldiers without their consent. The surgeries were forced, performed on people who weren't transgender, simply to fix their homosexuality by changing their bodies. Lobotomies were performed on gay people. Chemical castration was used. Hormones were administered to correct homosexuality. These were standard medical practices performed in hospitals, covered by insurance. None of it worked. You cannot change sexual orientation through torture, but doctors tried for decades. Thousands of LGBTQ people were subjected to these experiments, many involuntarily. Homosexuality wasn't removed from the DSM until 1973. Some conversion therapy practices continued long after that. Some continue today in various forms, though increasingly banned. And speaking of practices that continued way too long, let's talk about surgical experimentation on women. Unnecessary hysterectomies. Throughout the 20th century, hysterectomies were performed on women at astonishing rates, often unnecessarily. Doctors removed women's uteruses for conditions that didn't require surgery or could be treated less invasively. But it gets worse. Some women were sterilized without consent during other procedures. A woman would go in for a C-section or to treat another condition and wake up sterilized. This was particularly common for Black, Latina, Indigenous, and poor women. In the 1970s, it was exposed that Indian Health Service doctors had sterilized Native American women without proper consent. Estimates suggest 25–50% of Native American women were sterilized during the 1970s. In California, thousands of women prisoners were sterilized between 2006 and 2010 without proper consent. Doctors pressured incarcerated women to agree to sterilization, sometimes during labor when they were in pain and vulnerable. The excuse was often population control, or that these women were having too many children. The reality was eugenics, reducing populations deemed undesirable by preventing them from reproducing. This wasn't ancient history. Women in ICE detention facilities were allegedly sterilized without consent as recently as 2020. A whistleblower nurse reported that a doctor performed hysterectomies on detainees at rates far exceeding medical necessity. Forced sterilization remains legal in some situations in the United States. The fight for bodily autonomy continues. And speaking of violating bodily autonomy, let's talk about what happened to Henrietta Lacks. Henrietta Lacks and HeLa cells. In 1951, Henrietta Lacks, a black woman, went to Johns Hopkins Hospital with cervical cancer. Without her knowledge or consent, doctors took a sample of her cancer cells. Those cells, called HeLa cells, became the first immortal human cell line. Unlike normal cells, they could reproduce indefinitely in a lab. They became one of the most important tools in medical research. HeLa cells were used to develop the polio vaccine, study cancer, test the effects of radiation and toxins, research viruses, and more. They've been used in tens of thousands of studies. Medical companies have made billions from products developed using HeLa cells. Henrietta Lacks died in 1951 at age 31. Her cells lived on. For decades, her family didn't know her cells were being used worldwide. When they found out in the 1970s, they learned that her cells had been commercialized without consent or compensation. Her family lived in poverty while companies profited from her cells. Researchers published her medical records without permission, violating her family's privacy. Scientists experimented on her children without proper consent, taking blood samples under false pretenses. It wasn't until 2013 that an agreement was reached, giving the Lacks family some say over how HeLa cells are used. They've never received compensation for the billions generated from her cells. Henrietta Lacks' cells saved countless lives. She's one of the most important figures in medical history, but she never consented to any of it, and her family was exploited for decades. And speaking of taking things from black people without consent, let's talk about J. Marion Sims's contemporary, Dr. Thomas Hamilton's heat experiments. Dr. Thomas Hamilton in Georgia in the 1830s and 40s conducted heat experiments on enslaved people. He believed heat stroke could be cured by specific treatments, and he wanted to test his theories. He would place enslaved people in a heated pit he dug in the ground. The pit was covered, essentially creating an oven. He'd heat them until they were near death from heat stroke, then try different treatments to revive them. Some continue to 47 p.m. subjects died. Hamilton would document what happened, adjust his approach, and try again on other enslaved people. He published his findings in medical journals. He was considered a legitimate researcher. His experiments tortured people to death in what amounted to an outdoor oven, and the medical community published his work. Hamilton isn't as well known as Sims, but his experiments were equally horrific. Enslaved people were property, so doctors could do whatever they wanted to them in the name of science. And speaking of medical torture disguised as research, let's talk about what happened in Japanese-occupied China beyond Unit 731, Epidemic Prevention Research Laboratory. While Unit 731 is the most infamous, Japan ran multiple bioweapon facilities in occupied territories. The Epidemic Prevention Research Laboratory in Nanjing performed similar experiments on Chinese prisoners. Prisoners were infected with cholera, typhoid, anthrax, and plague. They were vivisected alive to study organ damage from disease. They were placed in pressure chambers until their eyes exploded. They were subjected to extreme temperatures to study hypothermia and heat damage. Women were raped and forcibly impregnated, then infected with diseases to study effects on pregnancy. Fetuses were dissected. Babies were killed immediately after birth for study. The facility also tested biological weapons on nearby villages. They released plague-infected fleas in Chinese communities and documented the resulting outbreaks. Entire villages were killed. After the war, like Unit 731, many researchers faced no consequences. Some went on to prominent medical careers. The Japanese government denied the experiments for decades. And speaking of governments denying medical atrocities, let's talk about what the US did to Guatemalans. With more detail. Full scope of Guatemala syphilis study. We covered this briefly, but the Guatemala experiments were more extensive than initially summarized. From 1946 to 1948, US doctors deliberately infected not just 700 but potentially over 1,300 Guatemalans with syphilis and gonorrhea. The methods were even worse than reported. When exposing subjects to infected prostitutes didn't achieve high enough infection rates, doctors inoculated subjects directly. They poured infected material onto open wounds. They abraded penises and poured syphilis bacteria onto the abrasions. Soldiers were infected, then sent back to their barracks to unknowingly spread disease. Prisoners were infected and received minimal treatment. Psychiatric patients were infected and couldn't consent in any meaningful way. Children as young as 10 were exposed to infected prostitutes at the psychiatric hospital. An epileptic woman was deliberately infected by pouring syphilis bacteria onto her cervix and urethra, then infected again after she'd been treated. At least 83 people died during or shortly after the experiments, though the exact death toll is unknown. Many subjects received inadequate treatment or none at all. The infections were deliberately given, then sometimes left untreated to study disease progression. The experiments were hidden for 60 years. They only came to light in 2010 when a historian accidentally discovered archived documents. President Obama apologized. Lawsuits were filed, but compensation has been minimal. And speaking of experiments hidden for decades, let's talk about what the military did with LSD beyond MK Ultra. Operation Third Chance. Operation Third Chance was a CIA program testing LSD and other drugs on people overseas, particularly in Europe and Asia. The goal was to test interrogation techniques and incapacitating agents on foreign subjects where US law didn't apply. CIA agents would dose foreign nationals with LSD without consent, sometimes in bars or social settings, then monitor their behavior. They tested whether drugged subjects could be interrogated effectively. They tested whether drugs could be used to discredit or incapacitate foreign agents. Some subjects were dosed multiple times over weeks or months. Some were held in safe houses and subjected to repeated interrogations while under the influence of hallucinogens. The program overlapped with MK Ultra, but operated internationally. Most records were destroyed. We know it existed only from fragmentary documents that survived and testimony from former agents. The full scope of Operation Third Chance remains unknown. How many people were dosed? How many died or suffered permanent psychological damage? The CIA destroyed the evidence. And speaking of destroyed evidence, let's talk about experiments that were literally buried. Holmesburg dioxin study, follow-up, remember Dr. Kligman, and Holmesburg prison? The dioxin experiments deserve special attention. In the 1960s, Dow Chemical paid Kligman to test dioxin exposure on prisoners. Dioxin is the main toxic component of Agent Orange. Prisoners had dioxin applied to their skin at concentrations 468 times the exposure levels that caused serious health effects in industrial accidents. Their skin developed chlorachin, severe lesions, and chemical burns. The study was supposed to track long-term health effects. It didn't. After the experiments ended, Kligman never followed up with the subjects. Many prisoners were released with no medical monitoring, no treatment for ongoing effects, nothing. Some developed cancers, some had immune system problems, but without follow-up, the connection to dioxin exposure couldn't be proven, which meant they couldn't get compensation or treatment. Dow Chemical got data showing that dioxin was harmful at much lower doses than previously thought. They used this data to argue that Agent Orange was relatively safe because the Holmesburg doses were so much higher. They weaponized data from torture to minimize liability for poisoning Vietnam veterans. And speaking of Vietnam, let's talk about what happened to Vietnamese test subjects. Agent Orange testing on Vietnamese. Before Agent Orange was used extensively in Vietnam, it was tested on Vietnamese and Laotian populations. Small-scale spraying operations were conducted to observe effects on vegetation and people. The military knew Agent Orange contained dioxin. They knew dioxin was toxic. They sprayed it anyway and monitored what happened to exposed populations. Vietnamese civilians were never warned. They drank contaminated water, ate contaminated food, breathed contaminated air. Children played in sprayed areas. Some studies directly monitored health effects on exposed populations, documenting increased cancer rates, birth defects, and immune problems. This research was classified. The U.S. continued spraying Agent Orange throughout the war, despite internal evidence that it was causing severe health effects. Approximately 20 million gallons were sprayed over Vietnam. 3 generations later, Vietnamese families still experience elevated rates of birth defects linked to dioxin exposure. The U.S. has never compensated Vietnamese victims. And speaking of generational harm from experiments, let's talk about nuclear testing effects. Marshallese nuclear test exposure. From 1946 to 1958, the United States detonated 67 nuclear bombs in the Marshall Islands. The Marshallese people were relocated, supposedly to safe distances. They weren't safe. The 1954 Castle Bravo test was 1,000 times more powerful than Hiroshima. The fallout was worse than predicted. Marshallese people on Rongelap Atoll, 100 miles away, were covered in radioactive ash. They developed radiation burns. Their hair fell out. The U.S. evacuated them after 3 days of exposure. Then, in 1957, the U.S. returned them to the still contaminated island to study radiation effects on human populations. This was deliberate. Documents show the Atomic Energy Commission viewed the Marshallese as a valuable exposed population for studying radiation. For years, U.S. doctors monitored the Marshallese, documenting cancers, thyroid problems, and birth defects. They provided minimal treatment. The studies were classified. Children were born with severe birth defects at elevated rates. Thyroid cancer became epidemic. Entire communities were contaminated. The U.S. paid some compensation in the 1980s, but far less than the actual damages. The Marshall Islands remain contaminated. Islanders cannot return to some atolls. The medical studies on radiation effects continue. And speaking of radiation studies, let's talk about what doctors did to cancer patients without telling them. Plutonium injection experiments. From 1945 to 1947, doctors at multiple hospitals injected 18 patients with plutonium without their consent. The patients had various conditions, some terminally ill, some not. They were never told they were being injected with radioactive plutonium. The goal was to study plutonium metabolism and excretion for the Manhattan Project. Scientists working on nuclear weapons needed to know what would happen if workers were exposed. So they injected patients and collected their urine and feces to measure plutonium levels. One patient was a house painter hospitalized with a broken leg. Doctors injected him with plutonium, then monitored him for years. He thought he was receiving treatment. He was a human test subject. A pregnant woman was injected, and her fetus was exposed to plutonium in utero. Several patients were injected and died soon after, allowing researchers to perform autopsies and measure plutonium concentrations in tissues. The experiments were secret for decades. Families weren't informed. When the studies were finally exposed in the 1990s, the surviving patients and their families were compensated, but many had already died. And speaking of secret experiments revealed decades later, let's talk about total body irradiation. Total body irradiation on cancer patients. From the 1960s through the 1980s, researchers at the University of Cincinnati and other institutions subjected cancer patients to total body irradiation experiments funded by the Department of Defense. Patients received massive doses of radiation to their entire bodies, far beyond what was medically necessary for their cancers. The goal wasn't to treat cancer, it was to study how soldiers might function after exposure to nuclear weapons. The patients, mostly poor and black, were told they were receiving treatment. They weren't told the doses were experimental and potentially harmful. Many experienced severe radiation sickness, vomiting, diarrhea, hair loss, burns. At least 25 patients died within weeks of radiation exposure. The experiments continued for 2 decades. Over 90 patients were subjected to total body irradiation. That was primarily for military research, not their medical benefit. A lawsuit in the 1990s revealed that researchers had misled patients about the purpose and risks of the experiments. The university paid settlements, but admitted no wrongdoing. And speaking of experiments disguised as treatment, let's talk about what happened to schizophrenic patients in the 1950s. LSD therapy for schizophrenia. In the 1950s and 60s, psychiatrists experimented with giving LSD to schizophrenic patients. The theory was that LSD might provide insight into psychosis, or possibly treat it by inducing a therapeutic crisis. There was no scientific basis for this. Doctors just gave powerful hallucinogens to people already experiencing psychosis and watched what happened. Some patients had psychotic breaks that never resolved. Others experienced terror and confusion. A few reported positive experiences, but most found it traumatic. These weren't controlled medical studies with proper safety protocols. These were psychiatrists giving experimental drugs to captive populations in mental institutions. Patients couldn't refuse. They were committed. Doctors had total authority. If a doctor decided a schizophrenic patient should take LSD, that patient took LSD. The practice ended when LSD was criminalized in the late 1960s, not because the medical community decided it was unethical. And speaking of experiments that ended for political rather than ethical reasons, let's talk about what the CIA was still doing in the 1970s. Project Often was an MK Ultra sub-project focused on toxins and drugging techniques. From 1968 to 1972, the CIA tested various substances to incapacitate, sicken, or kill targets. They experimented with biological toxins, chemicals, and drugs that could be delivered through skin contact, injection, or ingestion. They tested these substances on animals, but also on human subjects whose identity remains classified. The project worked with medical researchers, biochemists, and even occultists. The CIA was interested in whether techniques like voodoo or witchcraft had any real basis that could be weaponized. The program overlapped with MK Ultra's ending. When MK Ultra was exposed in the mid-1970s, Project Often was also shut down. Most records were destroyed. What little we know comes from testimony before the church committee. The full scope of Project Often remains classified. And speaking of biological weapons research that continued secretly, let's talk about Edgewood's more recent history. Edgewood tests continue. We talked about Edgewood Arsenal experiments from 1955 to 1975, but experiments continued in modified forms. Even after the Biological Weapons Convention, the U.S. continued defensive bioweapon research requiring human test subjects. In the 1980s and 90s, soldiers continued volunteering for chemical exposure tests. They were exposed to riot control agents, low levels of nerve agents, and other substances. The Pentagon maintains these were legitimate tests of protective equipment. Veterans say they weren't fully informed of risks and have suffered long-term health effects. The VA has fought claims from these veterans, arguing the exposures were minimal. But the pattern is familiar. Soldiers exposed to chemicals by their own military, then denied proper medical care for resulting illnesses. And speaking of patterns that keep repeating, let's talk about burn experiments. Holmesburg burn experiments. Back to Holmesburg Prison one more time. Beyond dioxin, Dr. Kligman conducted chemical burn experiments on prisoners. He was paid by Dow Chemical, Johnson & Johnson, and other companies to test how various chemicals affected skin. Prisoners had chemicals applied directly to their skin. Researchers would deliberately create chemical burns, then test treatments. They documented healing times, scarring patterns, and pain levels. Some prisoners had hundreds of small burn wounds on their backs from repeated experiments. They were paid a few dollars per experiment. Some participated dozens of times. The burns were photographed and documented. Prisoners' backs became maps of chemical exposure, covered in scars from substances ranging from dioxins to industrial chemicals to cosmetic ingredients. This continued for 2 decades. Kligman made millions from pharmaceutical and chemical companies. The prisoners got a few bucks and permanent scars. And speaking of permanent damage for minimal compensation, let's talk about what was done to soldiers at Porton Down. UK's Porton Down experiments. The British government ran chemical weapons tests at Porton Down from the 1940s through the 1980s. Over 20,000 British soldiers participated, many not fully informed about what they were testing. Soldiers were exposed to nerve agents, including sarin, mustard gas, and other chemical weapons. They were told they were testing cold remedies or helping find cures for common illnesses. Ronald Madison, a 20-year-old serviceman, died in 1953 after being exposed to sarin. The government covered up his death for decades, claiming it was an accident during legitimate research. An inquest in 2004 ruled it was unlawful killing. The British government apologized and paid compensation to test subjects, but only after decades of denial. Many veterans suffered long-term health effects, cancers, respiratory problems, neurological damage. Like American veterans, they were denied medical care because their exposure was classified. And speaking of government facilities where ethics went to die, let's talk about the Holmesburg successor. Stateville Experiments Beyond Malaria. Stateville Penitentiary didn't just run malaria experiments, it was a testing ground for various pharmaceutical trials and medical experiments from the 1940s through the 1970s. Prisoners were used to test experimental antibiotics, cancer drugs, vaccines, and other pharmaceuticals. They were exposed to infectious diseases, given experimental treatments, and monitored for results. The facility was considered an ideal research setting. controlled environment, captive population, minimal oversight. Pharmaceutical companies paid to use prisoners as test subjects. Prisoners volunteered for reduced sentences or small payments. But in a prison environment, volunteering is complicated. When your alternative is serving more time, consent is questionable. Some prisoners participated in dozens of studies over years. Their bodies became data points for pharmaceutical development. Some suffered permanent health damage. Some died from experimental treatments. And speaking of pharmaceutical development on vulnerable populations, let's talk about clinical trials in developing countries. Pfizer's Trovon trial in Nigeria. In 1996, during a meningitis epidemic in Nigeria, Pfizer conducted an experimental trial of the antibiotic Trovon on children. They enrolled 200 children, giving 100 Trovon and 100 a comparison antibiotic. The trial violated ethical standards. Parents weren't fully informed it was experimental. Consent forms were questionable. The comparison antibiotic was given at doses lower than recommended, potentially making Trovon look more effective. 11 children died during the trial, and others suffered serious side effects, including brain damage. Whether Trovon caused these outcomes remains disputed, but the trial's ethics were clearly violated. Pfizer was sued by Nigerian families and the Nigerian government. After years of litigation, they settled in 2009, paying $75 million. They never admitted wrongdoing. The case highlighted how pharmaceutical companies sometimes conduct trials in developing countries with less regulatory oversight, using vulnerable populations as test subjects. And speaking of pharmaceutical companies behaving badly, let's talk about Tuskegee's international versions. Similar studies in South America. Tuskegee wasn't unique. Similar syphilis studies were conducted in Guatemala, as we discussed, but also in other countries. Throughout the 20th century, researchers studied untreated syphilis progression in various populations. In some studies, subjects were infected deliberately. In others, researchers simply didn't treat people who already had syphilis, so they could study natural disease progression. These studies disproportionately targeted poor people, racial minorities, and colonized populations. In Central and South America, indigenous populations were sometimes used as test subjects without proper consent. The logic was always the same. These populations were going to get syphilis anyway, so why not study it? Or, these people don't have access to treatment anyway, so observing untreated disease isn't actively harming them. This reasoning ignores that researchers had the ability to treat but chose not to. They prioritized data over human lives. And speaking of prioritizing data over lives, let's talk about what happened during pandemics. 1918 flu transmission experiments. During the 1918 flu pandemic, researchers tried to determine how the disease spread. So they conducted transmission experiments on healthy volunteers and prisoners. At a naval facility in Massachusetts, researchers exposed volunteers to flu patients. They had sick patients cough on healthy subjects. They took mucus from sick patients and put it in healthy subjects' noses and mouths. They even took blood from sick patients and injected it into healthy subjects. Strangely, many subjects didn't get sick, suggesting transmission was more complex than thought. But the experiments continued, with researchers trying various methods to deliberately infect healthy people with a disease killing millions. Some subjects did get sick. The mortality rate for 1918 flu was high. Researchers were deliberately exposing people to a potentially lethal disease to study transmission. The volunteers consented, but they may not have fully understood the risks, and prisoners who volunteered were likely doing so for reduced sentences or better treatment. And speaking of pandemic-related experiments, COVID-19 challenge trials were proposed in 2020. COVID-19 human challenge proposals. When COVID-19 emerged, some researchers proposed human challenge trials, deliberately infecting healthy volunteers with COVID-19 to test vaccines and treatments. The ethics were hotly debated. Proponents argued it could accelerate vaccine development and save lives. Opponents argued that deliberately infecting people with a novel virus without proven treatments was too risky. The UK conducted challenge trials in 2021, infecting 36 healthy volunteers with COVID-19 in a controlled setting. All were young and healthy. All survived, though some experienced prolonged symptoms. The trials provided valuable data. No one died, but the ethics remain contentious. Was it acceptable to deliberately infect people with a potentially deadly virus, even if they consented, even if it might help develop treatments faster? These questions echo throughout the history of medical experimentation. Where's the line between acceptable risk and exploitation? And speaking of lines that shouldn't be crossed, let's talk about what's happening right now. Current placebo surgery trials. Today, researchers sometimes conduct placebo surgery trials. Patients are randomized to receive either real surgery or sham surgery, where they're cut open but the actual procedure isn't performed. This happens in trials testing whether surgeries actually work. For example, trials testing knee surgery for arthritis have included sham surgery groups. Patients receive anesthesia, incisions are made, but the therapeutic part of surgery isn't done. The patients consent. They know they might get sham surgery, but they're undergoing real surgery with real risks from anesthesia and incision without receiving the potential benefit. Ethically, this is justified by saying we need to know if surgeries actually work better than placebo effects. Scientifically, it makes sense. Ethically, it means people undergo surgical risks without therapeutic benefit. It's still controversial. Some argue that informed consent makes it acceptable. Others argue that subjecting people to surgical risks without therapeutic intent violates medical ethics. This is happening now in hospitals with ethics board approval. And speaking of things still happening that maybe shouldn't be, let's talk about off-label experimentation. Off-label drug use, as experimentation doctors can legally prescribe drugs for off-label uses not approved by the FDA. Sometimes this saves lives. Sometimes it turns patients into unwitting test subjects. When doctors prescribe drugs off-label, they're experimenting. They're trying something without solid evidence it works for that condition. Sometimes they inform patients, sometimes they don't. Patients often don't realize they're receiving experimental treatment. They trust their doctor knows what they're doing. They assume the prescription is evidence-based. Some off-label uses become standard practice and are later proven effective. Others are eventually shown to be ineffective or harmful. But in the meantime, patients are the experiment. This is legal. It's widespread. It's how medicine evolves. But it means medical experimentation is happening constantly, without formal oversight or documentation. And with that slightly unsettling thought, we've reached our final experiment, the replication crisis. Here's the uncomfortable truth about all these experiments, good and bad. Many of them probably produced unreliable data. Modern science is facing a replication crisis. When researchers try to replicate famous experiments, they often can't get the same results. This is true across psychology, medicine, and other fields. Estimates suggest that up to 50% or more of published research findings may be false or exaggerated. Studies are poorly designed. Results are cherry-picked. Data is manipulated. Statistical significance is misunderstood. This means that many of the experiments we've discussed, even ones that seem to produce useful data, may have generated unreliable results. People suffered for nothing. Lives were destroyed for bad science. The Tuskegee study's data on untreated syphilis, possibly unreliable because subjects weren't truly untreated. They received some medical care for other conditions. The Nazi hypothermia data, possibly unreliable because Rasher was sadistic and may have manipulated results. The horrifying truth isn't just that these experiments were unethical. It's that many probably didn't even produce good science. People were tortured and killed, and we didn't even get reliable data from it. And that brings us to the end. Conclusion. So that's 50 medical experiments they didn't teach you in school. From monkey testicles to brain electrodes, from deliberate infections to sham surgeries, from Nazi death camps to American prisons. The most disturbing pattern isn't that these happened, it's that they keep happening in new forms. The vulnerable are still being used as test subjects. Prisoners, poor people, psychiatric patients, people in developing countries, anyone without power to refuse. Medical ethics codes exist now because of these experiments. The Nuremberg Code, the Declaration of Helsinki, the Belmont Report, they were all written in response to atrocities. But ethics codes only work if they're followed, and history suggests they're followed until they're inconvenient, until there's something important to learn and a convenient population to experiment on. So tonight, as you drift off to sleep, remember that every medical advance has a human cost. Some of that cost was paid willingly by volunteers who understood the risks. Much of it was extracted from people who had no choice, no voice, no power. The doctors who performed these experiments weren't monsters, mostly. They were scientists pursuing knowledge, physicians trying to cure disease. They just decided that some people's suffering was acceptable in service of the greater good. And that's the most unsettling truth of all. These weren't villains in a story. They were people who thought they were doing the right thing, just like the people conducting medical experiments right now. Sleep tight, don't let the bedbugs bite, and maybe think twice before volunteering for that clinical trial.